Hello, I'm Dr. Shalita, and welcome to our clinic. Here we've been able to put together a team of professionals that apply a multidisciplinary approach that addresses your problems at their root cause. Here in our office we offer an array of services, including physician services, a clinical nutritionist, a craniosacral therapist, a chiropractor, physical therapist, myofascial therapist. When you come to our clinic, you can expect a team of professionals that care about what they do and care about you as a patient, care about you as an individual. They want to make you better, make you well, make you more energetic, increase your vitality and energy level. In doing so, we address you as an individual in a very specific pattern to you, your problems, your body, your needs. Let me take us on this journey. In the US, there's two types of physicians and surgeons. There are the allopaths who are MDs, and there are the osteopaths who are DOs. They both go through the same length of education and training depending on their respective residencies and specialties. The difference is that DOs in the first 2 years of didactics, which is the time you spend in school studying books and taking exams, in addition to that, they spend time training in this hands-on, musculoskeletally focused approach to wellness and health. That ranges from high velocity, low amplitude treatments such as cracking and adjustment to a very subtle hands-on approach called craniosacral osteopathy, which is mostly what we provide in our clinic. Hence, DOs bring something extra to the table, what I like to call the third axis of your well-being. We look at things a little differently, in a third dimension maybe, and gives us a better approach and a better vision of what you personally need. So the advantage is that you can do the conventional stuff, including writing prescriptions and ordering labs and seeing patients on a conventional basis for regular issues within your specialty. We can address illnesses such as asthma, migraine headaches, depression, anxiety, ulcerative colitis, irritable bowel syndrome, neurological issues, and other chronic illnesses by hands-on approach. That's the advantage. So, craniosacral osteopathy is a branch of osteopathic therapy that uses very subtle touches of hand without any what we call high velocity, low amplitude maneuvers, which are basically cracking. We don't do that in craniosacral osteopathy. The approach is with subtle touch. Most of the time, patients fall asleep during the hour of treatment. The challenge is for me to address your problem at its root cause. In order to do that, I need to expand my horizon. I need to get out of that conventional box. I need to think outside the box. Here in this clinic, that's what we do. I'd like to know about you as an individual, about your environment, about your history, what you consume, what makes you tick, what makes you better, worse, what is your stress level like? I'd like to get to know you in every access that there is. In doing so, we're able to apply principles that address you as an individual, your genomics, your interests, your needs, not a collective group's interests and needs. Chronic illnesses such as diabetes, hypertension, high cholesterol, arthritis, backache, neck ache, really reduce the quality of life. They take the oomph out of the way you live. That is not fair. Life is too short and you only live one life. You have to change your life, and we're here to help you do that. The problem in chronic diseases such as diabetes is that the building block of you as a human being is ill, it's diseased, it's not functioning properly. That building block is the cell. Cell wall has antennas in it that recognizes the environment of the cell and gets the cell to act based on what's in the environment. If you keep zapping the cell with sugar, at some point it will become resistant to it. Hence you develop type 2 diabetes. If I can help you revitalize that cell wall and get the cell antenna to recognize the sugar in your blood again, then we've reversed diabetes, have we not? We can do that through lifestyle modification and some of the nutraceutical therapies that we have. Some of the most advanced ways of thinking outside the box include the philosophy of what we call functional medicine and nutritional genomics. We have multitude of very specific and out-of-the-box type of tests. The main three that are my favorite that allow me to figure out what's going on in your body are the food sensitivity testing, the stool testing, and ultimately the adrenal testing. Stress is the mother of all illnesses. Stress will affect you health-wise from head to toe. It will start by getting you fatigued, very vulnerable to infections. It'll make you moody, depressed, anxious. It'll allow you to accumulate fat weight around your belly. It will cause a lot of problems. The problem is that you can't get rid of stress. You can only optimize your physiological response to stress. In order to do that, you have to look at your nutrition, what you eat, and how you supplement yourself. You need to test your adrenal gland, which is your stress gland in your body. That's what gets consumed when you're stressed out. At some point, it crashes and it burns, and it gives you all those symptoms because it can't keep up with your environment and your stress level. When that happens, we have to test it, we have to find the areas of vulnerability and deficiencies and replenish them and maintain your stress response ongoingly. The main way to do that is by taking very specific nutritional supplements and by having a nutritional plan, very specific to the adrenal rebuilding. Having said that, you can only imagine how important nutrition and food sensitivity becomes in maintaining gut health. What you eat becomes who you are. I tell people all the time, stress is the mother of all illnesses and nutrition is mother of all medicines. So for that reason and for that reason alone, I thought incorporating nutritional services guided by a clinical nutritionist whom actually has the knowledge and the experience to help us with guiding our patients in terms of what do they have to eat on a daily basis. If you're on the go, if you're busy, if you can't really spend $100 a day on groceries, what can you do to really reach that goal of eating the appropriate things? We don't utilize program or diets. We utilize a teaching methodology to change your lifestyle. We show you the light. You feel so great that you want to go for more. Now, I usually joke with my patients and I tell them, you do what I tell you, and weight loss will be just an icing on the cake, meaning that it's like good work done, the money will follow. So if you do what I tell you, you will be rebuilding your physiology from inside out, increasing your metabolism, starting to rebuild that capability to increase muscle mass and hence dropping the weight. So you ultimately will lose weight, that's our program. But the way we do it is we get it from inside out rather than by restricting your caloric intake. There is no question